Good day, everyone. Welcome to another episode of the Second Direct podcast, the podcast that teaches you to be proactive with your health, as well as knowing different things about different ailments and how to manage them effectively and positively. Today, we're going to talk about a topic called hepatotoxicity, which is basically what makes our liver toxic. We're going to explore hepatotoxicity as it is. What are the things that makes it toxic? What does the liver do? What don't we want it to be affected by so that the liver function does not get impacted? This is all we're going to dive into today, and we hope you stay informed and you enjoy this episode as best as you can. See you on the other side. Well, among healthcare professionals, it is generally accepted that diet and nutrition plays an important role in the management of diabetes, and it is necessary to supplement them with vitamins and mineral salts because they play a crucial role in managing these cases. Patients often struggle to maintain an adequate diet, especially when it comes to portion controls, weight loss programs, and stressful lifestyles. And additionally, these vitamins and mineral salts provide specific benefits to these patients. Alphabetic Plus is a supplement designed specifically for pre-diabetics and diabetics because it contains alpha lipoic acid, which is a powerful antioxidant, and also contains 24 other essential minerals and vitamins. Research has shown that alpha lipoic acid is the universal antioxidant, acting on both water and fat medium. It also helps to metabolize the breakdown of carbohydrates and acts on oxidizing species and free radicals. Additionally, it can recycle other antioxidants such as glutathione, coenzyme Q10, vitamin C, and vitamin E. It is not like every other multivitamin as it is uniquely designed for pre-diabetics and diabetics. It only contains vitamins and minerals needed by the patient's category at specific strength and proportion. Additionally, it does not contain copper or iron compounds, which pre-diabetics and diabetics should not take. It also benefits in preventing polyneuropathy. Things like numbness, burning sensation, paresthesia, tingling sensation, all these conditions that are associated with diabetes and end organ damage. So as I've stated before, alpha lipoic acid is an antioxidant that works against free radicals and reactive oxygen species. It also serves as a universal antioxidant, helping with carbohydrate metabolism and improving glucose uptake by enhancing insulin sensitivity. Additionally, it recycles antioxidants such as vitamin C, vitamin E, coenzyme Q10, and glutathione, which ensures proper cell function. So Alphabetic Plus does not contain iron and copper, as research has shown that iron and copper are generally in high concentrations in diabetic patients as well as pre-diabetic patients, and they are major sources for radicals generation. Hence, one will be worsening the problem by this additional supplementation. Yes, Alphabetic Plus has cardioprotective benefits because it consists of two crucial ingredients, taurine and lycopene, shown by research to have cardioprotective benefits. Taurine, for instance, exerts anti-inflammatory benefits that improves diabetes and has shown cardioprotective benefits by acting on the renin-angiotensin system, while lycopene exerts cardioprotective function by lowering low-density lipoproteins associated inflammation as well as modulating high-density lipoprotein functionality towards anti-atherogenic effects. The anti-atherogenic effect is the process of forming plaques in the intimal layers of the arteries. It has anti-inflammatory and antiplatelet effects like blood clotting and impairs cholesterol synthesis. So with Alphabetic Plus, it has a lot of benefits that you should consider, especially as a pre-diabetic or a diabetic patient. And I hope that all these light that I've shared on all these benefits will inform your decision appropriately and will let you know that Alphabetic Plus is the best multivitamin to get out there. So what is hepatotoxicity? It's in the word hepatotoxicity. Hepa is liver. Toxicity is what makes the liver toxic. So what makes the liver toxic or what damages the liver includes things like chemicals, drugs, herbal or dietary supplements. The liver itself, we always want to make sure to be careful for it not to be damaged, as it is a very vital organ responsible for doing a lot of things, which also include things like metabolizing medications, producing of essential proteins. It's the site of making sure that the breakdown of glucose is effective. It makes sure that the blood is also detoxified. Whenever harmful substances affect the liver, that's where we get to hepatotoxicity. And this can be subdivided into three different parts, especially depending on how it is clinically presented. And that is hepatocellular, cholestatic, or mixed. When we say hepatocellular, we mean that what is primarily affected are the cells inside the liver. When we say cholestatic, we mean that this is the tubes that are linked to the liver that are the root cause of the toxicity of the liver. The tubes leading into the liver, which we have like the bile duct, for instance. If there's any affection of the bile duct leading to the liver, we have a presentation that is cholestatic. And if it is the affection of the cells of the liver itself, we have a presentation that is hepatocellular. Then we have mixed, which is the combination of both the hepatocellular and the cholestatic. So the two mechanisms of hepatotoxicity, are intrinsic, which is dose dependent, or idiosyncratic, which is more unpredictable. So when we're talking about the mechanism of action of affection of the liver, the exact mechanism of affection is unknown, although it is said to be a combination of host, drugs, and environmental factors. The host being, age, gender, genetics, the immune of the patient, and metabolism. While drug factors being the dose of the drug, the duration of the drug being in your body, the weight and the degree of lipophilicity. So when we talk about lipophilicity, we're looking at how the molecule mixes with either with oil more readily than it mixes with water. So environmental factors include use of alcohol, your diet, smoking, with tobacco and toxins. So when we talk about the most common causes of hepatotoxicity, we need to look first into medications. A lot of the medications that we use usually have a pathway where they reach the liver first. And a lot of medications can cause drug-induced hepatotoxicity. These medications are typically over-the-counter medications, things like, acetaminophen, for instance, that's paracetamol, or antibiotics, or antifungal drugs, or anti-epileptic medications. These medications I've seen to be able to cause hepatotoxicity. Moving forward, we have herbal supplements, which is much more pertinent in this part of the world because a lot of people always have these things where they have, in quotation marks, if you're Yoruba, agbo, for instance. A lot of people use things like that because they feel like the local herbs are more effective in the management of their ailment than any Western medication. But the flip side of this is that these substances, these drinks can cause hepatotoxicity, especially if they include things like a green tea extract or kava or even some certain herbal medications. Thirdly, we have alcohol. Chronic alcohol consumption is a surefire way to affecting your liver. It can cause what is called alcoholic hepatitis or alcoholic liver disease, chronic alcoholic liver disease. So you need to be careful in terms of your consumption of alcohol. Reduction or total cessation of alcohol consumption is advised. We have things like industrial chemicals, exposure to industrial chemicals. These are occupational hazards. Things like tetrachloride or carbon tetrachloride or vinyl chloride can cause hepatotoxicity. Now, hepatotoxicity can also lead to a range of symptoms. So, if your liver is affected, you have to watch out for some of these symptoms. One is jaundice, yellow eyes, or yellow skin, or yellow nail beds. You have to watch out for that. You have to watch out for the feeling of being fatigued or weak, abdominal pain, especially in the right upper quadrant of your stomach. You might feel abdominal pain there. Also, dark urine. When you urinate, you might start noticing that your urine is coke colored. That is that shows an affection of your liver. Pale stools too. Now, these things work hand in hand. If you have a coke colored urine, you tend to have a pale colored stool, especially if the affection of your liver is hepatocellular. Now, when it comes to prevention of your liver being affected, the things that we already spoke about that affect your liver need to be controlled. So, medication management is number one. Always follow prescribed dosages, prescribed medication. Make sure that medications that you take are prescribed by a doctor, not abusing medications or always going to get over the counter medications every time, regardless of the symptoms that you have. Always make sure to limit your alcohol intake. Like you take alcohol to a chronic level, 3 to 4 drinks a day and above. You can slowly taper it down. Now your liver will be very thankful for it. If you're taking medications that are known to be harmful for your liver, make sure to constantly, regularly monitor your liver function test. Your healthcare provider will be able to give you a treatment map in terms of if he knows that the drugs that you're taking affect your liver, so that if you're consistently doing regular monitoring with him or her, they would be able to tell when the drug is doing way more than it's meant to do. Avoid harmful substances. Minimize your exposure to industrial materials and industrial toxins. If you are in an occupation that has you very close to these materials, make sure to wear protective clothing. Make sure to protect yourself at all times. Be very clean and monitor how long you are in that exposure. You are exposed to industrial toxins. Now, hepatotoxicity is a very serious condition. We just gave an overview of what it is. There are different. If we take each of how these things are affecting the liver, we can take each of them as their own particular ailment on its own. And it's a very serious condition. But if you take proactive steps to curtail this condition, you don't have any issues regarding hepatotoxicity, especially if you limit your alcohol consumption, if you are able to protect yourself against industrial toxins, if you manage the medications that you're using and only take medications that are prescribed by a doctor. You should be full-on head-free and not have to bother about hepatotoxicity. So we have come to the end of another episode of Circle Direct. I remain your host, Dr. Tiwa, and thank you so much for listening to us. If you have any questions or if you have any comments, please make sure to use the comment section below, and we'll be very, very glad to go through each and every one of them. Bye.